Welcome, listeners, to Connect the Dots. I'm Alison Rose Levy, and I'm here with you every Wednesday at 10 a.m. Eastern Time on the Progressive Radio Network. We're now in the 11th year of our program that's been running here on PRN FM, and what a year 2020 is turning out to be. I'm a long-standing journalist and activist for the environment, health and food, policy, political engagement, civic engagement, and transitioning our society to one that is pro-health and pro-environmental and pro-caring as our core values. Each week on the show, we talk with different experts, doctors, scientists, authors, advocates, filmmakers, television producers, economists, journalists, poets, and a whole host of people who each focus on or delve in depth into a specific aspect of our interconnected ecobiological world. Today, I am delighted to have a guest returning to the show who's been on many, many times, actually. She's Dr. Margaret Flowers, MD, and I became aware of her work during the fight for what became affordable health care, a.k.a. Obamacare. I mean, that's what it wound up being. But before it became defined that way, many of us had a wide range of different hopes about what a really health-oriented rather than profit-oriented caring healthcare system could look like. And at that time, Dr. Flowers was championing in universal health care, and we'll discuss that a little bit more on the show. She is an organizer and co-founder of Popular Resistance, which is a terrific, basically online newsletter with wonderful articles, as well as a radio program that she and her partner Kevin Zeese do together. So we're really delighted to be speaking with Margaret today, and we'll be talking about her current article, which I think kind of coalesces a lot of wisdom and focus for the current crisis of the of the virus, of the pandemic. So welcome back to Connect the Dots, Margaret Flowers. Lovely to have you here.
Thank you for having me, Allison. I appreciate the invitation.
So, your article really, there's been a lot of debate and confusion, politicization, mystifying, theorizing, and kind of almost like a spectrum of different concerns that cloud our way to understanding what's going on with the coronavirus and seeing our best sort of political civic pathway toward containing it and helping people, regain health or avoid the virus, avoid contracting it, or avoid perishing from it, which is currently at risk. And so I felt that your recent article, which appeared on popularresistance.org, really was very clarifying and helping people to refocus from a lot of the confusion. The article, listeners, for those of you who might want to go to the website and read it, which is certainly worthwhile doing, is the United States is where COVID-19 deaths are being underreported. I think, again, you're peeling away a layer of politicization, who is to blame, rather than basically trying to take the most constructive actions that are needed. There's a lot of finger pointing going on and wanting to blame dump on other people rather than taking responsibility for doing the most necessary and helpful actions. Do you want to kind of just talk a little bit about what the current political accusations have been, as well as what the problem really is as you see it?
Sure, thank you. Yes, this has been a situation that has been highly politicized at a time when what we really need is clarity. I'm sorry. I'm still recovering from recent infection. What we need right now is political clarity and leadership and coordination on this effort. But we've, gone through a whole series of mistakes, from the fact that the United States was alerted early on that this was a epidemic that could potentially be a pandemic, and the U.S. didn't take it seriously, where the leadership was calling it a hoax and using it to, bash the other party, and then not taking appropriate measures to make sure that we had what we needed. The U.S. was continuing to export medical supplies that we need here to other countries at a time when other countries were limiting their exports to prepare for the infection, and just a whole lack of willingness to recognize the severity of what we were facing. And so a lot of people have been misinformed, even, from the leadership, about how serious this is and what they need to be doing. And then there's a whole the aspect of this being used to weaponize this virus against other countries, which we could go into in depth. There's been a lot of China bashing over this, which runs counter to the facts that China responded appropriately, reported to the World Health Organization, took appropriate steps once they recognized that there was human-to-human transmission, and that this was a serious situation. China took effective measures to control it and has had excellent data that Western researchers and the World Health Organization have been looking at. So we're seeing in the media now this whole narrative, trying to distract from the fact that the United States has utterly failed to contain this epidemic and a pandemic and care for its people, and instead is trying to shift attention to look at China and say, oh no, China's the one that's not reporting, their deaths and their cases, when in fact it's actually happening here.
Now, that last statement that the underreporting of deaths is happening here is kind of like, the sleeper shocker. There is a certain portion of the population that is willing to participate in the finger pointing and name calling, and its loyalty to government leaders leads people to be misled, and then kind of diverting their attention and energy from the really salient thing, which is that there in fact is not less death. This is not a fiction or a fantasy or a hoax, but there's actually more death that's happening that we're not aware of, that's being underreported. Can you go into that a little bit more for our listeners?
Sure. And, one of the big mistakes that was made in the United States was not having tests for the COVID-19 available and a plan, reasonable guidelines for the use of them early on. Instead of accepting the test from the World Health Organization, which other countries were using, the United States chose to create its own test. The CDC had some problems rolling that out, and tests were sent out that didn't have the proper materials, so they couldn't be used. And so they had these very strict guidelines of who could be tested, and you had to really be in the hospital or have come from an area that had a high number of cases, like Wuhan in China, in order to qualify for getting tested. And so there's a study that just came out of the University of Texas at Austin that says that we're probably only finding or reporting 1 in 10 cases of this virus in the United States. So we are now well over 400,000 cases, which, if we use their data, means that we actually have 4 million cases in the United States. And I know anecdotally that I'm hearing from lots of people who have symptoms that are consistent with the COVID-19 who were not able to get tested. So, it also, is consistent with what I'm seeing. And then the same thing with the deaths. And there are people who are dying, but they didn't have a chance to get tested. And in New York in particular, where there's a very high number of cases, they're finding that their number of deaths in home have escalated by 180 to 195 deaths a day, and they suspect that many of these are due to COVID-19, but they don't have the test, so they're not doing testing post-mortem. And besides that, they're so overwhelmed they can't really even focus on that. So they're seeing things like an increase in cardiac arrests, and we know that the way that the virus functions, it causes fibrosis in the lungs, scar tissue in the lungs, which makes it harder for the heart to, pump blood through there. And so this, for someone who has underlying heart disease, could lead to or instigate a heart attack. And so, and then the other thing is that the McClatchy just did an excellent report, and they found that in February and early March, there was a spike in pneumonia deaths that were not due to the flu, and they suspect that those deaths were due to COVID-19. So it's likely that, the number of deaths that we're seeing is much higher than what's being reported.
That's very serious, because on the one hand, you have people saying, oh, these numbers are not, some people are saying on the fringe are saying these numbers are not revealing, anything worse than the normal flu, although, of course, it is highly contagious and affecting many more people and causing these deaths. Some people are just kind of poo-pooing it, but we really can't take that seriously for a number of reasons, but especially because we're missing numbers, and they will never be caught up. It's like if it's not being collected now, this is another, big fail not to have the right data, because then we really don't know how we're doing. Also, what was the reason for the idiosyncratic rejection of a pre-existing test to then produce a test in short order that, creates an austerity situation where we're not only underreporting deaths, but people don't know if they have it or not. They have no way of validating that. They don't know if they're infectious to other people. They have to kind of presume they are. Everybody, therefore has to presume they are, and in fact many may be. But, it would certainly be more validating to know that you're staying at home for good reason, or to kind of rein in the people who don't think it's necessary to shelter at home and to avoid potentially infecting other people when there's no test. We're just in the wild world where everyone has to guess about this.
Absolutely. They said that it's not unusual for the United States to want to create its own test. And I suspect that that's true because in the United States, where healthcare is a for-profit, entity, corporations are always looking for ways that they can profit off of this. So, it's in the U.S. corporate interest to not take a test that's already been produced and just purchase it and use it. There are probably many, and there are many places where they're trying to develop their own tests, which they can then sell. So that was a huge mistake, because if we look at countries around the world that are actually taking effective measures to hold this virus in place, it's founded on a basic public health approach of testing, identifying people who are positive, isolating them, monitoring them, identifying their contacts, and, contacting them and perhaps testing them. What you try to do is really, as much as possible, isolate people who are positive to stop the transmission, or at least to slow it severely. And we really missed a huge window to do that. In the University of Texas study, they estimate that 72% of counties in the United States have the virus spreading there, and that these 72% of the counties represent 94% of the population. They say if just one person in your community is diagnosed as positive for COVID-19, there's a 51% chance that that virus is already spreading in your community. So this is part of the reason why we now have a widespread shelter in place, because of this mistake, because of the failure to be able to identify people and quarantine them, notify others, take appropriate measures. The other really telling part of this is just how weak our public health infrastructure is. In China, for instance, in just Wuhan, they had, I think it was 1,800 infection teams. They were teams of 5 people who were tasked with following up with anybody who was positive, monitoring them, identifying their contacts, and making sure that they were isolating appropriately and getting what they needed. We really are severely lacking in that area, and this is one thing that we could be doing with the number of people who are being laid off right now. It would not be hard to train them in, answering phone lines, calling people, tracking this data. and that would make a lot more sense in starting to contain the virus.
That's really an excellent idea. It's almost as if both the public health infrastructure that should be in place in a large, complex society like ours, or anywhere, has been, kind of sort of taken down, and it isn't commensurate with the kinds of health risks of our complex society or of our time. But even the very phrase public health, is kind of meaningless to people. It's like it's kind of a void area where people don't even know that such a thing should be in place or exists. It's just incredible. I mean, it's kind of like on the parallel side with taking down safe and health-oriented regulations that would protect people from, unhealthy ingredients in foods, in products, in environmental activities and energy activities. We've not only poorly regulated that to favor business, but we've also deconstructed the whole concept of public health and the infrastructure of public health so that there's nobody standing up to comment or to alert or to track or to follow. And we're really, all of this is coming home to roost right now. And further, I mean, the institutions who are advising, like the CDC, they're supposed to be public institutions, but if they go along with refusing a valid and pre-existing test in order to develop, a for-profit test, then they're not really, that credible in terms of the service they provide as public health watchdogs. So, all of that is happening. What would you see as being other constructive measures that need to happen? Because, we're right now in a period where people are sheltering, depending on the state, for different time lengths. But the sense is that, this could be a continuing thing, that at the end of whatever the defined sheltering period is, without testing, we have no way to know where we are in terms of either containment or in terms of it's time to go back out and do normal things again, so-called. I mean,
right.
That's kind of a back-end problem on this.
Right. I mean, there are a lot of things that we should be doing, and I think first and foremost, we need leadership at the national level. Right now, it's really counties and states taking the initiatives on their own, trying to figure out what would be best. But we are a country, and this is a countrywide problem, and without really leadership from the top telling states and counties what they should be doing, if one place is taking appropriate measures but their neighbor is not, then that's going to harm the place. That doesn't really help. It doesn't make what the one county is doing to take effective measures really that effective. So we need some clear direction on, looking at the data. How long should we be, sheltering in place, making it nationwide, and then making sure that people who are sheltering in place are not harmed by that they're not, financially harmed because they can't work and they're not able to pay their rent or pay their mortgage or get access to food. So all that has to be part of it. We're also seeing, to me, which, I know we have a for-profit healthcare system. I've seen the really terrible destruction that causes, but I really didn't imagine that it would be as bad as it is right now, where we're seeing states competing with each other for medical supplies, for protective equipment, for ventilators, and the corporations are price gouging. There was a report that New York is paying up to 15 times the amount of money for their medical supplies. And, what we need at the national level is either price controls or bulk purchasing of the medications, the personal protective equipment, ventilators, all the things that we need, and then making sure that the areas that need them are getting the amounts that they need. But instead what we're seeing is this politicization where states that, the governor has offended the president are not getting the supplies that they need. The governor of Massachusetts was being denied supplies and had to actually charter an airplane, I think it was the Patriots airplane, to go to China and purchase the supplies there for his population. So instead of seeing this coordination and solidarity between our states, we're seeing this kind of brutal battle for supplies, and health professionals are not being protected. Workers, essential workers, are not being adequately protected. And so, if we lose our health professionals and our essential workers, where does that leave us? So we really need to see much better coordination and, making sure that places can get what they need. Also, education, public education about this. People still aren't clear about what does shelter in place mean. If I visit, if I have my family over, is that a problem or not? We just need to see really clear guidelines on this. And then I guess one more thing if I could mention is just making sure that there's no financial barrier to care. Not only should the testing be free, but treatment should be free, and no one should have to actually pay for it and get reimbursed. It should just be free, because people are not getting care, not getting into the system because they're afraid of the financial consequences of that.
Yes. What does it cost, for example, to be tested or to get treated? I mean, are you aware of what the typical costs might be, or is there, are there different differences, or where does that stand right now? If you happen to know what the numbers are on that.
I don't know the current numbers. I know early on it was fairly expensive to get tested, and I think I saw one case that was like $1,400. But I know the average cost of hospitalization for someone is like $35,000, and if they're in the intensive care unit, can be much, double or more that. It's like thousands of dollars a day to be in the intensive care unit. So this is something that people think about, and I wonder about those people who are dying at home. Why didn't they get into the system? And if they didn't have that fear of calling the doctor, and in an economic downturn, when everybody's worried about their economic security, it makes that incentive to not seek care even greater.
Right. That's right. And, the other irony of the whole situation, or tragedy really, it's not an irony, it's a tragedy, is that there's this lack of testing. The treatment, is highly invasive and not always successful. And and I speak as one who has championed and followed and promoted, holistic preventive approaches for the last 30 years, So there's also both lack of knowledge about what preventive approaches might build the immune system so that one might not so easily get the infection, as well as to minimize the intensity of the infection, which in itself constitutes a form of treatment, because you're then surviving. And it's a given that many people would not be able to economically afford to access these treatments, and that, the people who supply these kinds of things may not be prepared, for millions of people to suddenly be, wanting their treatment. So there's already, a lack of equity built into that. And yet, even so, to whatever extent we're able to kind of lessen the intensity, prevent the getting the infection, and increase the surviving of the infection, without incurring these hospital procedures that are, overwhelming the healthcare system, and for which we are not properly, the healthcare system is not properly supplied. That too would be beneficial. But then there's this big, kind of gap around that. And so with all of these things, we basically have something that could be contained and treated, that could potentially, the severity of which could be lessened. But all of that is very hard to come by because of the failure of leadership at the national level. If you ruled the world, where do you, what do you as we look at our political system today, it's in dire straits. Obviously, this president, what can one say? It's just a horrible situation, but we're not really seeing as much relief called for or provided by the opposition party as what's needed. I mean, how do you parse this out on a political level?
Yeah. It's a bipartisan problem. I mean, what it really goes back to is our economic and political system that's dominated by money. And, if you look at the way that our economy is structured, it's really where, profit reigns, and the health and well-being of the people and the planet are secondary to that. I mean, this, our for-profit healthcare system has been in existence for a long time and has worsened for a long time. And the Affordable Care Act did some positive things by expanding Medicaid, but overall it also subsidized that for-profit portion of our healthcare system and did nothing to contain the pharmaceutical corporations that are, misleading the public, pushing their medications, raising the prices, when there's a demand for it, all the things that are opposite to what we actually need to be doing. So I think that it speaks to the broader need for, a popular mobilization, which is why we started Popular Resistance, to push back, because once we start changing the national dialogue on these things, it starts to move that kind of political needle in our direction. So we are seeing, discussion of things that would have been never talked about before. There's widespread discussion of a national healthcare system, of, forgiving student debt, protecting workers, giving a universal basic income, all these things that wouldn't have been talked about before. And we're seeing, other countries, it's interesting, Spain and Ireland, both as a result of this pandemic, nationalized their hospitals because they recognized that having private hospitals wouldn't allow them to be able to, coordinate and, make sure that everybody who needed to get the care in their community could get it. So I think that in the United States, we ought to be talking about these types of things of, nationalizing our hospitals. We have an incredible situation where, 1975 we had 1.5 million hospital beds for a population of 215 million. Today we have 925,000 beds for a population of 330 million. So we've lost, hundreds of thousands of beds as our population has risen. And a big part of this is that hospitals have to make a profit. They have to be financially secure in order to keep operating. And sometimes when these hospitals start to weaken, these predatory corporations will buy them up. They'll extract whatever they can from them, and then they'll allow them to go bankrupt. And so we've lost many rural hospitals. We're losing about 30 or so rural hospitals a year, and about 450 of them that still exist right now are on very weak financial footing and could fail. We're also losing urban hospitals, particularly in neighborhoods that serve low-income communities that are gentrifying. The property that the hospital sits on becomes more valuable than the hospital. So you look at the situation in Philadelphia where Hahnemann Hospital, which has for over 100 years served its community, it was closed down. The city tried to open it back up to deal with this emergency, and the person who owns the property said, oh, well, you give me $1 million a month, you can open it up. This type of thing should be criminal, but that's what's happening in our country right now.
Yes, that's disgusting. I was at Netroots Nation last summer where we were protesting the closing of Hahnemann. I mean, just any wealthy person can come in and, his plan for it was eventually, I guess, to build luxury housing. That's happened in New York, the St. Vincent's Hospital. And so, people lose health care when these are, just regarded as hollow, real estate shells. I mean, the thing that I really wonder about is, it's really hard to gauge this, and it's kind of an unfair question, but when will people recognize what's going on and have enough, and say, this is enough, this is endangering me, whatever, media entities are kind of giving me diversionary, coverage that really isn't getting to the core of this problem. I need to turn them off, whatever side I'm on, because people are dying, communities are overwhelmed. We're losing, our healthcare professionals due to lack of proper equipment and preparation here. I mean, so the healthcare system 6 months from now is unless we do some major intervention, and by 6 months from now, I mean before, the election, the whole system is going to be in much worse state. Because we're just throwing the living beings of healthcare providers into the breach, here without proper protection.
Right. Not
so
to mention our bus
people,
drivers.
They're not going to be there. What was that?
Right. Right. Well, not to mention the other people that are essential to our, community functioning, the bus drivers that are not protected. There was a bus driver that was pushing back in Detroit, Michigan for protective gear because there were sick people riding on the bus, and he ended up dying of COVID-19. People who work in our grocery stores, all of these people that we suddenly realized, these low-wage workers, realize that they're actually integral to the functioning of our society, need to be protected as well.
Indeed. I mean, the post office, the USPS, was actually advising postal workers not to wear a mask up until this very week. They were going along with the sort of confused argument that if you adjust the mask, you're touching your face, which is specious because the whole point of wearing a mask is to protect the openings, to your mucous membranes in your nose and mouth. So if you were adjusting the strap over by your ear, that really isn't a big deal. Meanwhile, you weren't doing that, but then they weren't getting protection. They could be catching this. They could be spreading it to all who come in. That's another vector. Another vector is, for example, in New York. I'm a New Yorker, it's the New York subway system. So on the one hand, we have Cuomo being touted as a leader because he makes, these public appearances and he can speak a coherent sentence. And on the same time, he has been responsible and in control of the Metropolitan Trade Authority, the MTA, of New York State, which is, the kind of ruling agency for the New York subway system. And that is a terrible vector, because they took trash containers out of the subway system so that people could throw away tissue or something they blew their nose into or something else because they didn't want to. They were trying to save the cost of trash collection, and cleaning in the subway. They have, not dealt with the homelessness problem. He's cut Medicaid, and all of that goes to mean that there are more people who are sick and in need of health care in the system, exposing everybody. And so, you basically wipe out the transit system of a major city, and I think that's actually a major unidentified contributing factor to, why New York has become such a hot spot. And because he's been in the one who, who's had a grip on that and won't let any changes be made that he doesn't control and all of that, and he's basically failed to act. So people are admiring him on the TV and never seeing really the way in which he has been, I would suspect, at cause for New York's current, status vis-a-vis this virus.
Right. Yeah, and as we learn more about this virus, initially we thought it was only transmitted through droplets, meaning if somebody sneezed or coughed and, saliva or whatever came out and landed on a surface that contained the virus, and then somebody touched that and touch their mouth or nose or eyes, that they could get it that way. But now we understand that it's also airborne. So somebody, just being around somebody who's infected, who's breathing in close proximity, you can inhale the virus particles. And we also know that in places where they've done extensive testing, like Iceland and cities in Italy, they found that 50 to 75% of people who tested positive for the virus weren't showing any symptoms at all. So it's, it doesn't even mean that the person next to you, if they're not coughing, doesn't necessarily mean that they aren't carrying it and infectious. And they also found that, like many viruses, people are very infectious in a day or two before they show symptoms. So this is why, we need widespread measures of, many places are doing sanitation regularly, multiple times a day of their transit systems, and, any shops that are open and things like that, and exterior, areas, to make sure that the virus is killed, because it can also stay alive depending on the surface that it lands on, for up to several days. So everybody should be wearing a mask at this point. Initially, they were just telling people to wear a mask if you were, coughing or had cold symptoms, but everybody should be wearing one at this point.
Yes, they finally landed on that. I was thinking about it a month ago because it's like, what else are you going to do? In Asian countries, they do it, and yet, and also, it's a problem for certain populations because, some people might perceive people of color wearing a mask as, a threat to themselves because of racism and stuff like that. So, but it certainly, I think, is, understood to be a menace now, and we have people, sewing masks and doing all of this kind of thing. But how protective those masks really are, I don't even know, actually. I think that maybe, there are variations in protection. What do you see, given where we are, how should I say this? We're not really having a lot of help in, doing the right interventions. They're being done belatedly. We don't have an economic safety net in place to assure that all members of society could be treated, because it's not just an individual health problem, but it's a public health problem for anyone of any, economic status or any age or whatever to be infected, right? Because we can't just assume that people that we are disregarding or think, should have pulled themselves up by their own bootstraps or or other ignorant ideas. We can't assume that those people, are kind of out of sight, out of mind, and that they are not present, if not for, basic human concern, which is the way we should be thinking. That's the basis of solidarity. But in a competitive, individualistic society, we're not thinking that way. Many people are not thinking that way. So, but the people of whom that one isn't thinking about or concerned for can't be discounted, because for survival reasons for everybody, right? So, if we just think there's no problem, or that we won't get it, or that it's their problem if they're individually sick, what are the understandings that should help people break through this cultural conditioning, and really understand that anyone's contracting this and being ill is a problem for everyone else?
Right. I mean, we used to tell a story in the movement for National Improved Medicare for All about how in the United States we had fire insurance. If people didn't purchase fire insurance and their house caught on fire, the fire department wouldn't come and put the fire out. And they realized that this didn't make sense, because especially in, cities where houses are close together, if one person doesn't have fire insurance and their house catches on fire, it affects the whole neighborhood. Everybody's at risk. And it's the same thing with infections. If not everybody is able to get the care, to get tested, to be appropriately monitored and isolated if they're infected, then it affects all of us. We're not able to, we're not able to stop and slow the spread of the virus. As long as it's present in some sector of our population, all of us are at risk. And, people have been taking steps. I know in our city of Baltimore, we've pushed very hard to get the homeless out of shelters. They're overcrowded in the shelters right now. We have empty hotels sitting in our city. We should be giving hotel rooms to those who are willing to take them so that they can shelter in place, and we should be testing them and monitoring them to see if they're positive, to provide them the care if they need it, to get them through this, because it's we're not really going to get this under control until we actually take these types of measures to get it under control. And another very sad aspect of what's going on right now is that there's, looking at the deaths data and finding that a higher proportion of Black and brown people are dying of COVID-19 than whites. And this speaks to the whole kind of long history in our country of health disparities and, of Black and brown people versus white people, and also the fact that I know you are also concerned about environmental health, as am I, that we tend to place in, polluting industries in low-income communities, in communities of Black and brown people, and so that weakens their immune system, causes, respiratory disease, and it makes them more vulnerable to COVID-19. So I feel like this pandemic, as well as the economic collapse that it has triggered, which was something that economists have been predicting for quite a while. It wasn't, the foundation of our economic system has been very faulty with record levels of corporate debt and personal debt, and the banks have been struggling, and the Fed has been propping them up for months now. But it was triggered by the COVID-19 pandemic. All of this is showing the flaws in our system, which creates an opportunity. And you asked earlier, what will it take to get change? And I think so much is being exposed right now, and that's one thing that Trump has done as well, because he's just right out there and in your face with it. He's, all of these issues that we've had, racism, sexism, neoliberal economic policies, those have been going on for a very long time in this country, but he's just very open about it. And so I think people are feeling in a very tangible way the impacts of these systems, and so that creates an opportunity for us. And it's to me, I am glad to see so many organizations out there saying, no, we need this. We need, moratoriums on evictions and on rent, and we need workers to be protected. Workers all around the country in all kinds of sectors are striking over their working conditions, and all of these are positive steps that people are fighting back, because that's really what it's going to take to change things, and that's always what we've needed to do. And I think we are starting to see that tipping point coming in this country.
Yeah, and actually the Sanders campaign, although it is now beleaguered in terms of its continuity, although there's still opportunities to vote for him in a whole host of upcoming primaries if your state hasn't voted yet, and that's something to take seriously, because it can also kind of hopefully have some influence on the party platform, if not, make for an unexpected and profound change. But, people, I think, have, just hearing in a presidential campaign that, healthcare is a human right over and over, just hearing that, even with all the naysayers present who are going, well, no, it isn't, and, it's for all who want it, or people don't want to lose their employer health care, all of the, kind of specious arguments that were tossed against it, which now, of course, look absurd to,
right.
As people are laid off en masse and everything like that. We're getting a real education. There's no doubt about that. And so I think that has inspired people, whatever the unknown political outcome of this for the presidential election will be. I think that has inspired people to understand that other countries have these things and they're kind of basic, and instead of normalizing, the ways that our country is really behind and, off, so I think that may be part of it. Do you see this as being at a moment where it would have influence on the election itself, or do you think that we're kind of that's been so intensely captured and subverted that, by the way the two parties dance together, that it's kind of a non-starter? I know that you've always been a proponent of the third party, and and I have many friends who, are kind of like, why were you even trying to work in the Democratic Party, because they're so corrupt. So, where do you think that leaves us now politically,
right.
with all of this?
Well, my theory of political change or social change is not tied to elections. What we see really is that people who run for office reflect what the society is saying or demanding. So the fact that, Sanders has been able to be out there openly talking about wealth inequality, corporate power, healthcare as a human right. We've even seen climate change introduced into the debates this year for the first time. These are all a reflection of the movement, the political movement in the population that has pushed these issues to the forefront. So even though, in this election, the two major parties are going to have, these really awful corporate candidates. Joe Biden has a terrible history if you go back, and he's already said if Medicare for All came to his desk, he would veto it. I think that the power of candidates is that they have a platform and they're able to take these issues that are rising and gaining popularity and then really speak about them in a bigger kind of echo chamber that educates more people, and that's a hugely valuable thing, but it's always popular power that creates social change. So I don't think that people should get too invested in this upcoming election as if that's, going to determine victory or defeat in what we get. It's one part of it, but really if what we need to be doing right now, education is really key. It's why alternative media programs like yours are so important, so that people can hear these views, which I think are really common sense and supported by the majority of people, who recognize that health security, economic security, protection of the environment, that these are things that affect all of us and that are that we need and that other countries have, and we could be learning from them if we weren't sanctioning them or threatening them with military aggression. So I think that the key thing right now is to be putting out a bold vision of what we want. It's interesting. I am with the Green Party, and we do have a likely candidate. We haven't had our primary yet, but he's won a lot of the state primaries, Howie Hawkins. And I was talking to him yesterday, and he said, the Chinese character for crisis is opportunity, also opportunity. And that is something that we've been saying for a long time, is that every crisis offers an opportunity, because when you see a crisis, then people recognize that something needs to change. And so we can push that change. And so putting forward a bold vision, not kind of what we think we can get, but let's put forward what we actually need in this country and then mobilize and push for that. And I think that this decade is a very interesting one, because so many crises that we've been facing in foreign policy, with the climate crisis, environmental pollution, all of these things are coming to a head, and things are going to have to change. The U.S. is losing its domination in the world. The dollar is losing out in the world. Countries are finding ways to work around the U.S. dollar, and so something has to be done. And if we aren't organized with a vision of where we want to go, then unfortunately whoever is the most organized and has the most resources will be the one who wins out ideologically. So it's an opportunity, but it's also an important kind of crossroads where we have to put forward a vision of what we need, or we may end up with something that's even worse than what we have right now.
Mm-hmm.
Not to be, dire, but we could move in a more right-wing,
Can you sketch out, a little bit more of that scenario?
Of what it would look like to get the kind of change that we need, or what would happen, if we don't organize to do this?
Well, I think we talk about the change a lot. Let's talk about the stick a little bit. What are we looking at if we don't get this in terms of, you're saying, for example, another world power may emerge in better shape to handle this, and where our solutions have always been to try to either exploit, foreign countries for their resources, or to, fear them as the enemy that we're trying to maintain our hegemony against, and therefore to raise fear about them and all of the rest of it. So what you're saying is that perhaps any of the countries that are in the latter category, as we kind of continue on this eco-suicidal path that we seem to be on, could kind of step up and gain prominence and become, a leader in the world, which would then leave our country kind of in a further state of economic without the inflated options that we've been kind of creating to stay afloat, like in a worse state of collapse, is what you're saying. Is that right?
Right. Well, yeah, we have to recognize that the United States has the wealth and prosperity that it does because of our long history of exploiting other countries, for their labor and their resources. And the United States, at a time, it's really interesting where this is a global pandemic. Many countries are coming to each other's aid, but right now the United States is increasing economic punishment against Venezuela and Iran, two countries that are trying to fight off the pandemic, and instead we're punishing them more, and we're actually threatening Venezuela with military aggression. We're sending warships to their coast right now. Of course, people aren't hearing about this because everybody's only talking about COVID-19, but the rest of the world is seeing that, and countries are starting to finally speak out about this. The United States is currently imposing economic measures. Often people call them sanctions, but sanctions are a legal punishment, and these are not legal. These violate the United Nations Charter. We're sanctioning or imposing economic measures against 39 countries that represent a third of the world's population, and this prevents those countries from being able to get necessary resources like medications and food and parts to repair their, infrastructure. And so there's starting to become this kind of global awareness and pushback against the United States doing that. We've been organizing over the past year to try to educate around this. We have a Sanctions Kill campaign that we've been working on, and you now see the head of the United Nations and of the UN Office on Human Rights saying that these sanctions need to at least be paused. They should be saying that they should be ended because they're illegal. We're seeing countries like the UK, France, and Germany use an alternative system called Instex to be able to sell supplies to Iran. We're seeing China and Russia completely ignoring those sanctions, even though Russia itself is being sanctioned, and providing assistance to sanctioned countries. And so that kind of hammer that the United States has is not being effective anymore. Countries are finally starting to band together and stand up against it. The group of 77 plus China, which is the global South countries, have come out against it. The non-aligned movement, which is over 120 countries, have come out against the sanctions. And so what we're seeing is that the world sees that the U.S. is not a cooperative member. We're a punitive member. They see our incompetence in handling the pandemic, so they don't look to us as any sort of a leader in this situation. Meanwhile, you have countries like China that has a very rapidly growing economy, and when you look at indicators of the economy like purchasing power parity, China is actually ahead of the United States, and now China is actually providing supplies even to the United States, as well as I think around 80 other countries of the world. And so we're becoming a multipolar world where there's not one country that dominates, where other countries are learning to cooperate with each other, and that's kind of the gist of where things are going, but the U.S. is really resisting that, even though it's aware of it. The Pentagon put out a report called the Post-Primacy Report years ago, recognizing the U.S. was losing power, but their response was we need to spend more on the military, increase our surveillance over other countries, and increase our aggression. Those are the tools that the Pentagon knows how to use, and we need to say no. We're seeing now almost 2/3 of the federal discretionary budget going to the Pentagon. This is ridiculous. We need to be using this money at home. We have so many needs here. And just one final quick point on that is there was a report put out recently by the San Francisco Fed kind of looking at the economic situation. And when there is a pandemic, it's the economic recovery from that is very slow. It's decades to recover from a global pandemic, unlike a war situation where there's destruction of property and the need to rebuild that. And so another thing that we need to be pushing for at this time is saying our economy requires that we invest in the things that we need at home, building more hospitals, upgrading our infrastructure, moving to a clean energy economy. All of these things will create jobs and stimulate our economy and actually improve our health. We need to change our agricultural practices. There's so many things that we need to do. And this crisis is an opportunity for us to push for that because even the financiers know that. And so, we're just reflecting that reality, and I think that we have a chance of winning that.
Wow. In other words, are you implying that the corporations that are beholden and corrupt government is defending and giving resources to, that they themselves are realizing that we have to reconfigure and that the government is actually kind of lagging and limping behind? But the problem is that if it's left to the corporations to do it, we still have their parasitical, role in terms of taking all the resources unto themselves and profits in order to do it. So how does that work?
Right. Well, that's really important. And we posted an article on popular resistance yesterday that was actually from Reuters, and it talked about how there's been a kind of a global seismic shift in the thinking now that these central banks have been having to bail out these governments, and also kind of the recognition that, we've always been told that we couldn't have these things that we needed, like getting rid of student debt or public universal health care system because they're quote unquote too expensive. But now we know that the central banks can just print trillions of dollars and put it out there, and so that's created kind of a whole shift in the way that the world is thinking. In my view, the fact that these large institutions are recognizing that this is time for transformative changes just validates, what we're seeing and thinking, and not saying that we want them to do it, because we know that if people don't have a voice in this situation, that communities will be exploited and they'll be polluted and they'll be, they won't get the things that we need. So I think it's just a recognition that this is a time where things have shifted in a great way, that we have a need for transforming our systems because it's the systems that create the problems that we have. And if we want to address the problems, we have to change those systems. And then for us as people to say, we want a voice in this. Like if you look at the Extinction Rebellion, their second or third demand is that there should be citizen assemblies that are making decisions about how the climate crisis is dealt with, what kinds of policies are put in place. If you look at countries like Venezuela, they've created these extensive systems of community assemblies that meet and determine what they need in their community, and they also group together as larger groups of assemblies for larger projects, and then they go to the government and say, this is what we need, and they get the funding to do that. There are structures that have much more of a participatory nature, and that's how we make sure that our needs are prioritized.
That sounds fantastic. We're at the end of our show here, and this is like a really hopeful vision for maybe what will be the forms of rebuilding occurring in this incredible social breakdown that we're experiencing. Thank you so much for being with us today on Connect the Dots, Margaret Flowers. People go to her website, popularresistance.org, for her articles, her and Kevin Zeese's articles, posting of other articles, their radio program, and their insights and activist opportunities and all-around education for all of us on stepping up to a collaborative, solidarity, caring-oriented collective and community in this incredible time of change. So check out popularresistance.org, both for the article we've talked about today as well as some of the other things that Margaret has referenced in her conversation today. Thanks again, Margaret. It's been great having you here.
Thank you.
And thank you, listeners, for being with us for another edition of Connect the Dots. We'll be back next Wednesday at 10 a.m. Eastern Time on the Progressive Radio Network. I'm Alison Rose Levy. Keep sheltering at home and in solidarity with all our relations.